Good afternoon, everyone. My name is Shepard Smith, Head of Marketing here at Gravitate, and I'd like to thank you all for joining us today. The topic of today's conversation is the use of blended data for member engagement scoring, and while we'll move quickly through the next 30 minutes, we welcome questions and would like you to submit them at any time using the written chat function you'll see on the right-hand side of your screen. Everyone in the audience is muted, and we'll send all of you a link to the recording of this webinar tomorrow. Our first presenter today is Rob Miller, CAE, who many of you know both as a senior association executive at 340B Health, a trade association, and as president and co-founder of Avectra, the company that invented the modern web-based AMS with the launch of NetForum. Rob, I will now turn the presentation over to you.
Thank you very much, Shepard, and welcome everyone. We are talking about data today and data analytics. And this first slide, data analytics for everyone, is an important philosophy that we have here at Gravitate. And what that really means is we want everyone on the staff, from the most junior membership coordinator to the most senior executive, to be able to use the system and to be able to use it with very limited training. That means we shouldn't have to have the IT department involved. It should not require data scientists to run the system. It's intended to be for everyone. So that's a very, very important philosophy. As Shepard mentioned, I was at 340B Health before joining Gravitate. And we're going to be talking quite a bit about 340B Health today because I was there when we implemented Nucleus last year. And in fact, you're getting a little bit of a preview of a presentation I will be giving at the ASCE conference next week with a member of 340B Health and another member of our team. So we'll cover some of that material in this particular presentation now. So first of all, 340B Health is a trade association, a fairly good size one with 1,400 hospital members throughout the country. And we have about 15,000 individuals in the database, 7,500 that are very active. We're a mid-size association, and so we have rather complex requirements. And they're not requirements that are, unlike that many of you would have. But we certainly had a lot of requirements as related to data. So our challenge, and these challenges will resonate with all of you, first and foremost, is we wanted to, increase our member retention. We wanted to increase our acquisitions of new members. We wanted to grow our conferences and events. And we also wanted to improve our government relations effectiveness because as a trade association, we did a fair amount of advocacy and lobbying. So those were really the challenges we had in front of us, and the tools that we had prior to acquiring a data analytics solution were not of the sort that made this job very easy for us. So first of all, we had to come up with a plan and an approach. And it boiled down to three quick items. First was we needed to gather data from a lot of different sources and blend that data together. We had to build an engagement model, and then we had to find a solution that could support all of that. So let me talk a little bit more about each one of those. So first of all, when I talk about gathering the data from all the sources, many of you are probably looking at engagement in your AMS, but you have a lot of other very important systems at your organization. Your email marketing tool, your community, your survey tools, maybe a separate event registration systems. You want the data from all those systems. You want them brought into one central place, and then you want it blended together. And I mean blended, you want to be able to access data about an individual that was happening across all of those different platforms. It's very, very critical. The second thing was building an engagement model. And what we did with that is we had to determine the value of those activities that were taking place in each of those systems. For example, in your AMS system, you might be tracking if somebody attended a webinar or a conference. Maybe you'd give 50 and maybe 100 points for those two activities. At our organization, 340B Health, as I said, we cared a lot about advocacy and lobbying. So we would give a lot of points if someone called a member of Congress, met a member of Congress, or posted an op-ed in a local newspaper. We might give 100, 200, 250 points for those type of activities. But we also wanted to provide points for activities that were happening in other systems, like give maybe 1 or 2 points for reading or clicking on an email, maybe 5 or 6 points for accessing and reading and responding to a post in your social community. So this is what we did to build that engagement model, and I'll get into that a little bit deeper. And then, of course, we had to find a solution, and we wanted to have one that did not require IT support, either from an implementation of it or a use of it. And we wanted ones that had a comprehensive baseline, because quite frankly, we didn't know all the questions to ask. So we wanted help from a vendor that would be able to lead us down that engagement path, help us ask the right questions, and find those insights that were so critically important to us. We had a couple of other business considerations that we were looking at as we were going along. First of all, we wanted a system that was easy to use. I think I've kind of mentioned that already. I wanted everybody to use it. I wanted a system that had price stability. I didn't want to be surprised with having to pay for additional licenses or data storage fees. I wanted the system to be available from anywhere at any time. We had a lot of staff who worked remote. We had staff who traveled to conferences. We wanted to know the latest conference numbers when we were there, so we wanted to be able to see that on our mobile phones. And finally, we wanted a system that would help us with further engagement once we had found insights. So you go through and you analyze this data and you drill into it. Well, it doesn't really mean anything if then you don't have the ability then to act on that data. So we wanted a system that could facilitate that. There were some things that we needed to learn along the way to be successful. The first thing was we needed to identify the source systems that we wanted to access. And again, it's not just about your AMS. That's a critical component, or your CRM, whatever term you use for that. That can just be one of the systems. You need to bring in the other ones. Obviously, you need to have clean data. It's hard to have any good system without that. So, we looked at strategies to make sure our data was clean. We also found on the back end, though, that our data analytics solution, Nucleus, actually identified some data issues that then we were able to go back to the source systems and fix. We talked a little bit about the blending of data. We had to learn how important that was along the way. And then finally, we had to come up with that engagement scoring. And we'll get into another topic on that in a moment related to decay, which is also quite important. So I'm going to hit on each of these 4 items just a little deeper. The first one is we had to identify and prioritize which source systems we were going to integrate to the solution. So we picked our IMS, and we had a Higher Logic Community and Informs as our email marketing tool. Those were clearly the 3 most important systems, and those are the ones we started with. And just by starting with those 3, we got a lot of insight that we would not have otherwise received. As a phase 2, we're then looking at systems that some are systems that are supported in the industry, and some that come from outside the industry. Since we were a healthcare association, there's a software product called Definitive that has a lot of data on hospitals that we wanted to pull into the Nucleus environment. And then the government obviously posts a lot of data on Medicare and Medicaid that we also found valuable, that we could then blend with the data that was in with our other, what I would call, association data. So we started in the one place and then heading towards phase 2 after that. I talked about clean data. So how did we go about dealing with that? Well, fortunately, we already had a process somewhat in place. On a quarterly basis, we would have a team get together, and we'd have data stewards that were representing each part of the organization. And they would come together about once a quarter, and we'd identify things that needed to be cleaned up. Perfect examples where, you get new people who come to your website and they create a new record even though they already have one. Well, we would go through and we would have a process to clean that data up. So that was one important component, is making sure we stayed on top of that. So if you don't have a team like that, it's important to put one together so that you can make sure you have clean data. When you're looking at blended data, you want to have a common ID. So it's great if you've passed your ID from your AMS to all the various systems, but in some cases you might not have done that, so you might need to be then connecting on email address, for example. So it's important that when you're blending the data together that you have the ability to get to a consistent format so that it's useful when you pull it into your data analytics platform. Blended data, which was one of the primary topics that we had for this webinar. I wanted to drill in this a little further so everybody's really clear on what we're talking about. So in this simple example, we've got 4 systems that we're blending together: the AMS, the e-marketing, the social, and the survey tools. So in this case, assume that there's records for John Doe in all these different systems, but you can't really work with them together when they're all these separate places. But when you blend the data together, suddenly you can ask, who are your members that responded yes to your survey? And so you can ask questions when the data is blended together that you don't have the ability to ask when it isn't. The other thing that happens when we're blending data together is we transpose it and improve it as we bring it in. For example, we take the join date and convert it to tenure, and that just makes it as a real easy field for your staff to use. If they just want, give me the people with 0 to 3 years of tenure, they don't have to use greater than and less than when they're trying to build that query. They just pick that value. Same with age and the baby boomers or the generations, whether they want baby boomers or Generation X, very easy to pull that information. And so we will create columns of this new data in the system when we blend it in. And then finally, that pesky member type. Many systems will say someone's a member, but that really means that they're a regular member, and then you also have to validate that they have the status of active and have they paid or are they within the grace period? If you ask a junior membership coordinator to count the number of members and they have to know all those values, there's a good chance they'll get the answer wrong. But so when we put the data in Nucleus, what we do is we transpose it so that we just have something called member that takes into account all those requirements. Engagement and scoring and decay. So as I mentioned, we provided points to all the different activities we did. The screen on the left kind of shows activities that were taking place in IMUS, and of course it's only part of a screen. But for the ones that are critically important, we gave a lot more points. And certainly for the email communication and the community, we gave fewer points for their activities. And in some cases, we would put a cap on the number of points they could get at a certain area. We didn't want someone, just because they read 500 of our emails, we didn't want to give them too much credit. We also need certain activities to expire. So after they roll off a committee, they should no longer be getting points for that. Or we want certain things to decay. So maybe you, with emails or a posting in your community, you want them to have credit for that for 3 months, but in the 4th month, you want the decay and the credit to go away. So this is the concept behind using engagement scoring to then generate ultimately a score. And what you end up with is something that's incredibly effective for member and customer engagement. And first and foremost, if you look at the data from the highest level, you can see if your organization's engagement of all your members or all your constituents, whoever you're tracking, is growing or shrinking. And that alone is telling you whether you're doing effective things on behalf of your members. But then you drill it down to the lowest level. This is where you get the needles in the haystack, that you can figure out who your least engaged members are, which are your obvious retention targets. You can find your most engaged non-members, who your obvious acquisition targets. And then an example that Brandon will hit on is it can be used to find a board member or a committee member or that type of thing. And speaking of Brandon, at this point in time, I am going to turn it over to him so he can actually show you the system. He will be demoing some live client sites, so that the speed is the type of speed you would expect to receive when you're using the system, and he'll be showing different live sites of clients, but he'll try and hit on some of the comprehensive baseline that's in the system. So with that, I'll turn it over to you, Brandon.
Cool, thanks, Rob. So what I'm really going to try to focus on today, guys, is just showing you some of the visualizations that we helped 340B Health create during the entire process that Rob was just explaining to us. So essentially the way that Nucleus works is you log into it, it's a URL, you go and you type in your username and password. We can also hook up with your AMS or something like that to bring in over usernames from a different system if that's something that you want to do. But you log in, and the first screen that you're going to see is going to look something like this. And really where I want to start is by explaining the way that engagement scoring for 340B Health is organized within Nucleus. And so the first thing is that the first area, and so what we call carousels, are up here in the left-hand side corner of the screen. And basically you'll notice that there are a number of different engagement carousels that 340B Health has. One of them is organization engagement, then we have individual engagement, then we have individual member engagement. And so because 340B Health is kind of in the unique position, or I guess there maybe are some other associations that are out there where they know who all their prospective members are, we were able to bring in data about the prospective members as well. And so when we take a look at organizational engagement, in individual engagement, we're looking at not only members, but also prospective members. And then when we look at individual member engagement down here, we'll be looking at just the individuals who are members of the organization. So from the high level, when we look at organization engagement, and again, keep in mind that there are prospective members who are listed in here too, one of the first things that you'll notice is that we're looking at engagement points over time. And so this is just showing us overall how things are growing, how things are shrinking, how is our member database actually engaging with us. And so this is just one way we're looking at the total here. But we also have other clients who are utilizing engagement scoring where they're looking at an average. So they want to know per client or per member, what is the average points of engagement that they have with us. So kind of just two different ways that we're tracking overall engagement for our members. The next thing that you'll see here is the different buckets, or the different buckets that we've created to place members into. So you'll notice that there's a low engagement, medium engagement, high, very high, and then no engagement. And so again, keep in mind that the prospective members are also in here, so that's why we see organizations with no engagement as this big red bucket here. But if we dive down deeper into any of these visualizations, we'd be able to specify what we want to look at, and we'll see that bucket shrink and the other ones go up if we're looking at just the members. So one thing that this can help you do is that when it comes time for renewals or something like that, right? You've got this bucket of people who are in no engagement or low engagement that now you can pull from and start trying to talk about the benefits that you're offering towards them in hopes of getting them to renew. So you've got a warning sign of lowly engaged members. The next thing that you'll see here is average engagement by top 5 states, and this is just again by location. Within Nucleus, we do have the ability to do geographic breakdowns based on anything that you might want to divide by. So here we're looking at state, we could do country, we can do county, we could do congressional district. In fact, 340B Health has a congressional district filter, so we'll talk about that in a little bit here too. And then lastly, when we took a look at the engagement top 5, this is just going to show us the top 5, in this case, health systems that are engaged with this particular organization. Now, where I want to go is I'm actually going to dive down deeper into this engagement levels by org count. And so what this will allow me to do, and it's just going to pop up here in just a second, is start to identify and filter by other criteria over here on the right-hand side of the screen. So for instance, you'll see that congressional district, where if I had, somebody, where I'm doing some advocacy in a particular congressional district, and I want to find a member who's highly engaged in there and maybe ask them to do something, for us in that district. Right, I can go ahead and just pop up my filters here, select who that, what the congressional district that I need, and then down at the bottom of the screen, I can actually access the data table that allows me to see who are the members that are engaged in that particular congressional district. So for instance, if it was congressional district NY12, now I'm looking at, so I can filter and sort this guy down here at the bottom. So now I can look at either the least engaged members, or if I want to look at the most engaged, I can flip it the other way. And so now if I'm looking in congressional district 12 and I want to find the highest engaged person, I can see that it's NYU I think it's Langone Hospitals, if I move this over here. So that, that's just one way that you can go about identifying members who are highly engaged or lowly engaged. And the opposite of that is that, I think this is actually a true story of something that happened on Rob's team, is that they had a junior membership coordinator who decided that she was going to go ahead and start reaching out to the members who had low engagement in particular regions and in particular areas based on the filters that she was applying over here on the right-hand side of the screen. So she very quickly and easily identified her targets in order to start talking to those people. The other thing that you can do is that when we're looking at the member type or the member status over here on the right-hand side of the screen, this is where we're going to see those members or prospective members. And this comes into play when we're, again, taking a look at that total engagement points that is happening over here on the left-hand side of the screen. And so if I apply the prospective member, I can then very quickly and easily find members who find prospective members who aren't members yet but have engagement with the organization. So again, gives us a very quick and easy list to target. So the other thing that I want to point out here too is that if we look at this organizational points by activity, it'll take just a second for it to load up here, but what it's going to show me is actually all the individual activities that are taking place. So not only can I look at it from an aggregate, but I can also dive down deeper into, I want to see each of the individual activities that are happening. I can start doing things like comparing people who are in engagement levels. Like if I wanted to find out from, who's in the low level and what have the people in the medium level done that the low level people haven't. And then maybe I can start identifying, well, this hospital is interested in this, and then they, engage when I talked about this, so I can start, figuring out types of content to apply to different groups or different segments of my membership. The last thing that I want to talk about is the example that Rob mentioned a little bit earlier, where they use their engagement scoring to help them identify a new board member. And so when I look at my individual engagement here, again, you're going to notice, because these are all the actual members that are a part of the organization, that no engagement bucket has shrunk here and it's smaller. But one of the things that Rob's organization utilized this for was for finding, I guess when they have a call for board members, they typically have around 75 people apply or put their name into the hat to become that particular board member. And so what they're able to do is use the engagement scoring here at the nucleus. And if we look at this, top 5 engaged, it's going to give us a list of the members who are engaged most frequently and have the most points. And so when it pops up here, what they're able to do is automatically just apply a filter to find those people that had applied for this, open board seat, and just kind of only take the top 10%, the most highly engaged members who had applied for that, or nominated for that. So, that was one of the things that they were able to do that would have taken them weeks to go ahead and find out and research how engaged all these people actually are with the organization beforehand. And so I think that is it for me. There are a few other things that I wanted to walk through, but I think we are coming up on time. So just one second here. I'm going to go ahead and flip back over to the PowerPoint. And okay, so I think actually maybe we have some time to walk through the next piece here. So there's one other thing that I want to go through as far as engagement goes, and that's something that we call sentiment analysis. It's not actually part of the engagement carousel that we're taking a look at here, but part of what 340B Health was also doing is analyzing the posts and things that were happening within their community. And so here we're seeing new topics and replies that were created over time. One of the really cool things that I think also plays into member engagement is that we're able to kind of see sentiment of things that are happening in the community by a number of different criteria. So if we wanted to see, overall within our community, how many posts are positive, how many are negative, how many have a neutral sentiment. Sentiment by word count, sentiment by post. But what the part that I think is really cool is that we're actually able to start seeing the top 40 positive and negative and overall top 40 words that are happening within each of those given communities. So, you can just start getting a feel of what's happening in your community without having to go through and read every single post. And so if I dive down deeper into any one of these, it should show me here in just a second. Looks like it logged me out for a second. So anyway, it would show you, you'd have the ability to filter by whichever particular community you wanted to see. So there are a number of different topics that you can filter by in there. All right, so that is it for me. I'm going to switch it back over to Shepard and see if there are any questions.
Thank you, Brandon. There are, and again, everyone, you're still welcome to present questions on the right-hand side of your screen. The first question says, you mentioned 340B Health is a trade association. How did you aggregate engagement score from individuals to hospitals?
That's a great question. So I think that Brandon somewhat touched on this, but maybe it wasn't 100% clear. So actually at 340B Health, we had both members that were organizations and we had members that were individuals. We had both things going on, but we also had this concept where we wanted to roll up activities from individuals to the hospitals. So essentially what we did is we created engagement scores for activities that were individuals were doing, and those would roll up to the hospital. Anyone who worked at that hospital, but the hospital itself could also do things. If the hospital made a contribution to the organization, the hospital itself got points. So essentially the engagement worked as you got all the value of the individuals, their points, plus whatever the organization did itself, and that would be ultimately what the hospital would get. And then we had one more tier, which is we had health systems, which are a collection of hospitals, and then again the engagement scoring would roll up from the hospitals all the way up to them. So it was a little bit confusing at first, but ultimately once we mapped it all out, it worked very well for us.
Thank you, Rob. Question number 2, how long does it take to implement?
Okay, so obviously that's a loaded question, but the simple answer is we like to break the project into what we call packages. So, Brandon went through some membership features. We also have packages around conferences, around fundraising. And so what we like to do is we like to do those, do one, and then as we're getting ready to be finished with the other one, we move on to the other one. And so what we try and do is we try and complete each package in about 6 to 8 weeks. So our goal is when you start working with us, that in less than 2 months, you'll have actionable results on whatever package or business area that you think is most important for your organization. Most organizations pick membership to start, but it's not an absolute necessity.
Okay, thanks. Question number 3, what if I only want the data lake and processing pipeline?
Okay, so we didn't, obviously the person who asked this question must have come to one of our other webinars, so they know a little bit more. So just to give a little bit of architecture, so when we pull all the data from all the source systems, what we do is we stick it into what we call a data lake. And then that data lake then feeds that information to the Nucleus front end, the visualizations that you see, and it feeds that through what's called an application programming interface, an API. So all that data gets passed through and you can see it and it looks beautiful. Well, what can also be done is if you want to use a productivity tool like Power BI Tableau, you can use that and attach to the data lake through those same APIs and pull out that data and do other analysis with it. In fact, it's not uncommon for some of our large organizations that will do both. So they will use the baseline visualizations that come with Nucleus, and then they will take those other tools to do what I would almost call like agile analytics. So they can quickly come up with maybe new insights, and when they find one they really like and they want the staff to all have it, we will then build it directly into the Nucleus interface.
Question related to scoring. How did you assign the points to engagement scores, i.e. 200 for event attendance versus 2 for opening an email?
Well, what we did is we basically sat down in a group and tried to assess the value that we thought each of these would be, and we, quite frankly, we kind of guessed. We took our good sense of what we knew mattered, and we also tried to think about what do we want to incentivize people to do, because we would give awards for the most engaged people. So if we wanted somebody to put an article in a newspaper, we wanted to make that engagement score very high. So what we did is we came up with a number of values, and then the year 2 we went back and we reevaluated those and we tweaked them a little bit. And all I can say to you in this is that you're never going to have something that's exactly perfect, but the worst thing is not to act. So I encourage you to take a stab at it, run it for a year, and then make some minor changes that better meet your needs. But either way, even the first year, you'll have a much better idea who your most engaged members are than before you did it. So with that, I think we've run out of time. I want to thank everyone for joining us today. We hope that you found the content and the 340B Health story very interesting and inspiring. As with all our webinars, we've recorded this session and we'll send it to you shortly. So please feel free to share it with your colleagues. And please visit our website. We've written a couple of blogs recently, one on total member value and another one on member-facing analytics. So please check those out. And finally, as I mentioned earlier, we will be speaking at the ASE conference. We will be exhibiting, we'll be speaking, and we're also having a party. So please visit us on our website for more information or call us to schedule a one-on-one meeting to discuss your specific data analytics challenges. And thank you again and have a wonderful day.